Hi, I'm Mark Johnston. I'm President and Chief Operating Officer of Cytonet's U.S. operations. I hope the next few minutes will be useful in helping you better understand urea cycle disorders, or UCDs, as well as to learn about a clinical trial that's currently enrolling for patients with urea cycle disorders.
My name is Rod Monroy, and I'm the Senior Director of North American Clinical Operations. Selica III is a phase 2 clinical trial. It's investigating liver cell therapy for the treatment of children with severe urea cycle defects. And it's open in 12 centers in the United States and soon to open in Canada. Selica III is open to children, both male and female, ages 1 day to 5 years of age, with severe urea cycle defects that occur at neonatal onset, and it will have enzyme deficiencies for citrullinemia, CPS1, and OTC. That's a very interesting question because liver cell therapy, the cells are placed in the portal vein of the liver via a catheter. And the cells, during this period of time, integrate into the parts of the liver right at the liver cell plate. And those cells then integrate in that integration process, provide the necessary enzymes that will overcome the deficiencies that these children have. Selica III trial is we're utilizing that to understand the efficacy of liver cell therapy as well as the safety of the liver cell therapy to treat urea cycle disorders. And the efficacy is very important to us understanding whether the cells will then provide the enzymes necessary to providing a bridge to eventual liver transplantation. The advances are right now our utilization of liver cell therapies. This is a new and novel technology that came out of Germany, and it's being applied to treat the patients and acting as a bridge before patients go to liver transplantation. They find out about the trial, and they're still a little bit nervous because they have a child and they may or may not show any deficiencies, even though they know genetically it exists. But they are pleased to see the opportunity to have this chance to treat their child. The Selica III trial is open to any referring physician in the United States that may have a patient with a severe urea cycle defect, and they would be considered a referring center. They can then refer that patient to one of our already established centers, and they can either contact us directly and we can put them in contact with one of our centers.
So for the trial, you can go to one of two sites. You can go to our website, which is www.cytonetllc.com, or you can go to www.clinicaltrials.gov. And then just for general urea cycle defect information, a great website is the National Urea Cycle Disorders Foundation, which is www.nucdf.org.